edition of the Dr. Fazil Show. We're here with Dr. Fazil this afternoon to discuss the global pandemic with this COVID-19. Welcome, Dr. Fazil.
Thank you, audience, for watching this show. Today we will be talking about the global shape of the pandemic. Although we have been talking about the impact of U.S. Pandemic of COVID-19, but again, we live in a different world now. It is a global society because we travel, and we travel fast because of the airplanes and different mode of transportations than in the past. So the impact of that transportation and travel is far more than it used to be in the past. So it's very important for us to keep an eye on what's happening in the world, in our neighborhood, in our neighboring countries, and countries which are not next to us but they're still connected. For example, India. So as you know, it's really a bad situation in India at this time. They have a lot of deaths and infections going on for various reasons. We'll talk that in a few moments about that. And we also want to learn from that so it doesn't happen here. So again, as I say, it's not over till it's all over.
Thank you, Dr. Fazil. We're hearing about various mutations of the virus. Can you help us out and explain some of the different variations and mutations of the virus, Dr. Fazil?
Yeah, so we call it double mutation. That means that the original virus has been mutated at two different genomic levels. We have double mutation from UK, but we also have double mutations from India as well. They are not the same, although they are both double mutations, but they're not exactly the same mutation. So Indian mutation is actually more contagious than UK mutation. So remember, like in USA, majority of the infection we have the UK variant, but we haven't got the Indian variant yet, which is actually, as you can see in the pictures behind me, that there are a lot of people are infected, a lot of people are dying, and the reason is that they have a different variant. They do have a UK variant too, but and on top of that they have the Indian variant, which is also a double mutation, but that mutation is different than the UK mutation, leading it to more contagious and to some extent more deadly as well. And we have seen some worse pattern, that it is affecting more of children and then affecting the adults, and then since they have a different family structure, they live together, and there's a lot of population in India, about 1.2 billion people. So the virus have a lot more chances to mutate because you have such a big host there, and that's unfortunate, but that's a fact, and that has caused to at least double mutation at this time. We don't know what is coming next, but if it becomes more deadly than what it is now, it's really a bad news.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
into detail on the double mutation. Even though you have two different variants of the double mutation, it just means that say the UK variation, that mutated and then it mutated again, but in a different area, the India one mutated and then mutated differently, but that does not make them both the same.
Exactly.
Is that correct?
That's correct. So they have two different mutations than the original virus COVID as we do the genomic sequence, genetic sequence of these viruses. And we call it mutation of concern and definitely a threat. So what we have now is definitely a threat, which is a double mutation from India, and it has different area of the DNA has been, or different part of the virus has been mutated as compared to the UK variant. And in India, they have different situation. I think it's not just a double mutation which caused such a heavy toll on the life, but they have a different system there of healthcare delivery. They don't have that strong infrastructure as we have in USA. Besides that, recently they were having religious events as well as political rallies, and because of that, there was some lack or oversight in using the mask and social distancing. Initially they did practice all that and they were fine, and then in the last few weeks or last few months, those two events caused lack of social distancing and sanitization and mask wearing. It led to more infections. More infection led to more replication of virus. More replication lead to more chance for virus to mutate. And then it come up with a virus which is immune to, well, first is more contagious, and number two is more deadly. Number three is have a different epidemic pattern, affecting children mostly than adults. And then adults get affected because they live together, and on the top of that, obviously, when you have such a huge population, no infrastructure would be enough to sustain that kind of crisis. And that's unfortunate, but that's what's happening. So the ramification of that is that now, since we already have this new virus, it's there, and who knows what's coming next. We might have a triple mutation, and if that happens, it might end up to something like more death rate than what it is, which is already high enough, and then it can transmit to the rest of the world, and that's a concern. That's a concern to USA as well. So we have to be careful that the new virus might not be immune to the vaccination we already got. Plus, it might not also be immune to the treatment we have if you do get infection and end up in the hospital, like remdesivir and the plasma, the immune plasma. So that's why I say it is not over. It's all over. Although we got it under control here to some extent. Here we also see some resistance in getting vaccination now because of some rare side effect with Johnson & Johnson and other vaccination. And I do understand that each person have a choice, of saying no to the vaccine. But I tell to my audience and to my patients that let's look at what's happening in other countries which are not following the full guidelines. Like Brazil, look at India, for example. So again, initially they got it and they were fine, and somewhere they lost the track of what kept them safe, and now we have a very, very bad situation. So it can happen anywhere, including the USA, if we don't follow the things which protected us in the first place. So we still have to keep doing what is absolutely necessary. Take the vaccine. Again, there's some rare side effect of some vaccines, for example, blood clots, which can move from leg and go to the lungs. But as long as you're aware of those rare side effects, and doctors are aware of those side effects, they can do early detection and treat it. Mostly those side effects are treatable, and we have to look at the bigger picture, risk versus benefit. What is more risky? So I think we need to get to the herd immunity. We also, at the same note, we also have to make sure that we do not get new strain here, because the new strain treatable with the current arsenal we have in our hand, like Indian double mutant virus or even triple virus, So that's why we need to do everything in our power, plus to some extent, have some kind of safeguard in place in immigration. So when people travel, we need to know their immune status so we can prevent the new strain to spread here, because then all efforts will go in vain. So that's what we have to be looking forward to, that, it's not over. We're almost there, but not be there yet. And even we get the herd immunity, if we get the new strain, it might be a new pandemic starting all over again. So that will be really bad for the economy and for health and everything else. We need to be vigilant for those things around us. That's why it is not just in what's happening in USA, but what's happening globally. We have to keep our eyes open and look around us and learn lessons from the countries which did not follow the guidance. Social distancing, sanitization, and immunization. Although I know in India it's a different situation. Infrastructure is not there. Only 2% of people have been vaccinated, and it's a big country. So nothing is going to be perfect, because it is what it is. But here we have a different infrastructure, so we should fully utilize that infrastructure in our country here in USA and stay out of trouble.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Do you think if the vaccination rate had been higher in India, it would have helped contain the virus a little bit more? Or since it's attacking the children were not getting the vaccine in the beginning, what impact would that have had on it?
Definitely the vaccine is the way to go. And unfortunately, even with everything they have in their hand, they have only 2% of their population been vaccinated, which is very little. I mean, if you look at it, they have, if you get to the herd immunity, you have to have 2 billion shots, because you have to have 2 shots, right? So you have to have around 75 to 80% of people vaccinated. Now we're talking about 1.2 billion people, so 75% of that would be around 1 billion. So now you have to have 2 billion shots, versus we are standing and again, it's not our fault in any fashion, because we can do what we can do, because the whole world is in trouble. So we're sending around 4 million shots to India to help them out. But from Johnson & Johnson, and we know it has some side effects, but again, we have to look at the bigger picture, and those side effects are treatable. So I know it's like a bucket, it's like a drop in the bucket, but we have to start from somewhere. It's always the first step, which is important in any journey. But again, it's not just the USA who can do it alone. It has to be other countries, European nations, everybody else have to join forces together, because this virus will keep coming back. So it's in our best interest that it's not just for their interest, but also for our interest, that this pandemic should be handled rather aggressively and quickly.
And with travel, I know they have restricted travel from India. What are the chances of somebody traveling from India to another country and then coming into the United States just to avoid being stopped because they were coming from India? Do they track that through the
Yeah, so
they
some
track that through
yes,
immigration?
they have already. I mean, some countries have banned travel from India, from and to from India. At this moment, we have not done it yet, but India by itself have done it. So they have banned a lot of travel, put a restriction on the travel to different countries. So they are actually preventing from the base, from India by itself. So they are pretty involved in containing the epidemic right there and then. It's not perfect, so you have to be careful, So I think the only thing that I can think of is that since they don't have vaccine, and I don't know how many months they're going to take to get vaccine. At the current rate, it will take them 10 years to get the fully vaccination.
Oh goodness.
So I know we don't have 10 years for that kind of pandemic. So I think the best thing would be to do, which works in the first place, was masks, social distancing, hand sanitization, and maybe lockdowns. Do what need to be done to contain the pandemic, and then also to prevent the stress on the healthcare system. And then these guys buy some time, and hopefully then the whole world jump in all together to give them vaccine, so the life can go back to normal. As I said, this is not just a USA thing; it is a global thing, and I have to make our audience aware of that. That okay, we know we seem like almost there, but again, this can worse at any time, and it would be just starting a whole new pandemic, a different virus, because it's mutating so fast. Remember, the virus mutates only when it replicates. It replicates in the living host. That's where it lives.
Right.
And if you have 1.2 billion people who have virus inside, you got a monstrous host which has a huge capability of replicating this virus. More it replicates, more mutation you're gonna get, and you need just one bad mutation to make it very, very deadly, which can spread worldwide all over again, as it was last year. And then again, as I said, it would not be contained by the tools we already have developed with billions of dollars and a lot of loss of lives. So that's what my concern is, that just keep your eyes open, be vigilant, and look at the global picture. And I think it is also important for people who have not taken a vaccine to look at those countries, see what's happening with them. As a matter of fact, in India at this moment, they're selling Moderna or other vaccine in the black market. Like, for example, Moderna is being sold in black market for $100 per shot. Well, here we're getting it for free, so we should be blessed. We should be feeling blessed that we are getting here for free, and we should embrace it and get it instead of saying no, because you can see in other countries like India or Brazil, for example, when they get an infection, they're begging for oxygen. I mean, you can see the basic need, oxygen. So here we are not that bad. So let's embrace the vaccine and let's get it, and let's get over this pandemic once for good. Once for good.
So even though the United States is on the road to recovery, we still we shouldn't waver from the original plan of wearing the mask, stepping up on keeping things clean and keeping things sanitized. Don't relax on anything, because we could at any moment have.
Yeah, I will say all hands on deck for now. All hands on deck. Again, we don't have to go too far. Just look at the videos, look at the picture from India, see what's happening there. It can happen at anywhere if we fail to follow the initial guidelines and initial precautions. So, as I said, all hands on deck till it's not over till it's all over. And with that note, I think we'll call it a day. And I hope we conveyed some important information in this show. Wendy, do you have any questions?
I think that about covers it for today. Thank you very much. Thank you, audience, for joining us for the May 2021 Dr. Fazil Show. And thank you, Dr. Fazil, for joining us as well.
Thank you, audience, for watching this show, and God bless, and we'll be back next month with more information.